Snoop is a 14-year-old long-haired wire fox terrier who had surgery 4 years ago to remove an underdeveloped metacarpal joint. It was likely that he was suffering from brachymetacarpalia and subsequently did not develop his associated phalange. Furthermore, the surgeon removed the fourth phalange due to an abnormal bone development. The nails of phalanges 2 and 3 grow upwards and cause him pain and discomfort if left to grow. He is obviously lame on his left paw and has subsequently increased loading on his right forelimb and contralateral hind. He tends to stand on phalanges 2 and 3 and frequently spreads his toes. When asked for paw, he was reluctant to give it, and he is also reluctant to sit and is more likely to lie down. He will not tolerate palpation on the affected limb. Currently, he is on no medication and was last seen by his vet in July. He has regular checkups and the vet are pleased with his progress from his surgery. At his age, the owner likes to give him a slower life and acknowledges that he can only walk for short periods of time. I did not see this dog prior to surgery, although the owner tells me that this issue did not seemingly affect him until he was first seen by the vet for moderate lameness when the vet suggested surgery. My concern is his way of going ultimately going to impact the unaffected limbs in the future? In walk, you can see that Snoop takes a wide-based stance in his hinds when walking and walks regularly on 3 tracks with the unaffected limb more medial to take his weight. This is more apparent when he is walking towards you. Snoop has very little carpal flexion in his affected left fore and was noted to hop on the affected limb to avoid weight bearing. Shoulder movement looks more restricted on the left, where he has also a very visible head nod, indicating left forelimb lameness. Here you can see he has a very shortened stance phase. The hind limbs move very short with little amounts of flexion and extension of the tarsal joints. This is worse than the ipsilateral hind, although you can see that he is attempting to place more weight on his contralateral hind, potentially as compensation for the forelimb lameness. Snoop's trot is almost non-existent. He trots almost as if he is an amputee with a similar sort of hopping gait. He frequently attempts to use canter, however tends to lead with the unaffected limb. Whilst this would place more weight on the affected limb, it is possible that the lack of retraction and protraction of the limb does not allow for a left lead canter. However, Snoop does apparently seem to trot with his hind limbs, as seen when he trots away, although this remains disunited with his forelimbs. In trot, he still has a very visible head nod from both front and behind. Although he appears to trot straighter compared to walk, he does still move on 3 tracks. He has better flexion on the right carpus, although left is visibly lacking flexion and extension. From behind there is also better flexion of the contralateral tarsal joint. Like some lamenesses where trotting may mask the appearance of being lame, this is not the case for Snoop. He's still very obviously lame in the trot. He also continues to hop every so often on the affected limb, missing out on footfalls to avoid weight bearing on the affected limb. Because of this, he has a very straight forelimb action, which is why he shows better elbow flexion on the right forelimb compared to the left. To conclude, the increased flexion of the tarsal joint on the contralateral hind is ultimately due to increased weight shift. This is further evidenced by the complete lack of weight support on the affected forelimb. This shift in weight distribution could be placing more strain on the contralateral hind, predisposing the hind to conditions such as degenerative osteoarthritis. Furthermore, the ipsilateral forelimb is also weight-bearing more, particularly noticeable in the walk, but is also evident as he ambulates on 3 tracks consistently with the ipsilateral more medial, also placing more strain and potentially predisposing it to injury further in the future. Cruz is a 14-2 7-year-old Welsh B cross TB. His breeding was that of a 12-2 mare and a 16-2 TB stallion. He was born with hyperextended metacarpal and tarsal joints. He was seen by the vet in May 2018 due to a suspected extensor tendon lesion on his left hind. He was placed on 6 grams of bute twice daily and given 2 weeks of box rest. On a second examination following the box rest, the vet was surprised at his seemingly sound gait and requested an immediate start on ridden rehabilitation, mainly in straight lines. Old footage of Crusader lunging, it is evident that his gait showed predisposition to his injury that was completely overlooked by myself. Within this video, he stumbles upon his left hind, overextending his tendon. This could have attributed or potentially caused his injury. Furthermore, you are able to see that he has very straight hind limbs, particularly within the hock joints. He finds great difficulty with engagement and has little ability to absorb shock through his limb joints, potentially predisposing him to SI injury and joint degradation. Therefore, it was no surprise that he had pain on palpation of his tuberous sacrale, which is currently managed using complementary therapies. In the lateral view, you can see his hind limbs walk with a very stiff gait through the hocks. He has a greater flight arc in the ineffective hind limb. Whilst he has been cleared as sound, I am not convinced that he is 100% stable, especially within the hind limbs. I feel that I see a very minute difference laterally between the extension of the hind limbs. This may be attributing to the pelvic asymmetry due to the right protracting slightly further than the left. In trot, he was seemingly unwilling to move forward and proceeded to tail swish. Here you can see some pelvic asymmetry, however his hock joints seem to flex significantly better compared with the walk. It has also been noted that he is very unbalanced, moving both up and down transitions. You can also see that he continues to hold his tail to the left. In the cranial view, you can see that he continues to circumduct his last forelimb, but this is to a lesser degree than in the walk. He also has a relatively low and relaxed head carriage and seems sound. However, in the lateral view, he continues to look sound but unstable and unbalanced. You can still see a slight pelvic asymmetry from the lateral view. He also raises his head coming into trot, although this has been much improved with transition work whilst being ridden. To conclude, his lack of flexion and subsequent impact absorption through his hind limbs means that he may be predisposed to SI injury and joint degradation of the affected joints. Furthermore, his history of extensive tendon lesion means that his tissue is going to be less elastic and may have a greater chance of re-injury. Currently, he still shows stumbling, particularly when being ridden, especially on that left hind. However, this has greatly decreased since implementing pole and lateral work.